Aortic valve is a valve between the left ventricle and the aorta. The normal area of the aortic valve is about 1.5 to 2 centimeters square. So whenever the area of the aortic valve fall below 1.5 centimeters square, it is called as aortic stenosis, mean the narrowing of the aortic valve. This narrowing is further divided into several categories. The first one is severe aortic stenosis and second one is critical aortic stenosis. Severe aortic stenosis mean that when the area fall below 1 centimeter square and the pressure gradient across the aortic valve is greater than 50 mm of Hg. So it is called as severe aortic stenosis. The second one is critical aortic stenosis. By the critical aortic stenosis mean when the area of the aortic valve fall below 0.7 centimeter square or the pressure gradient across the aortic valve is greater than 70 mm of Hg. So it is called as critical aortic stenosis. What happen in aortic stenosis? In aortic stenosis there will be fibrotic and calcified aortic valve. Due to this fibrosis and calcification there will be obstruction to the forward flow of blood. As you guys can see in this image, when this aortic valve get calcified and fibrotic, there will be increased pressure in left ventricle and the decreased pressure in aorta called as systolic blood pressure. This increase in left atrial pressure is due to the obstruction to the forward flow of blood. So the left ventricle is now contracting against a stenosed aortic valve. So this left ventricle will get hypertrophied. This hypertrophied ventricle will need more blood supply. So whenever there is an interruption of a blood supply, the patient will present with an angina in the absence of coronary artery disease. Apart from that, when this ventricle will contract against a closed aortic valve, at some point of time this ventricle will fail. So when this left ventricle fail, the patient will develop a heart failure and the patient will develop a breathlessness secondary to the pulmonary edema which occur due to the failure of left heart. Other than this, the patient will also present with a syncope. Why the patient will present with a syncope? As I discussed previously, that due to the obstruction to the forward flow of blood, there will be a decreased systolic blood pressure. So whenever there is decreased systolic blood pressure, the body blood demand will not be fulfilled and the patient will present with a syncope. So in short, the patient of the aortic stenosis have a three cardinal symptom: breathlessness, syncope and angina. Now let's discuss the causes of aortic stenosis. Remember that there are wide variety of causes of aortic stenosis, but the age group will simplify the cause of aortic stenosis. For example, if a aortic stenosis present during infancy, mean in first month of life, the patient may have a congenital mitral stenosis. Other than this, if a patient present with young or middle age patient present with aortic stenosis, the patient will have two causes. The first one is the bicuspid aortic stenosis and the second one is the rheumatic heart disease. The bicuspid aortic valve means that the aortic valve have a congenitally two cusp instead of three normal cusp. So due to the two cusp, there will be an early fibrotic and calcific changes in aortic valve. So the patient will have a aortic stenosis. The second one is a rheumatic heart disease. In rheumatic heart disease, if a patient have a aortic stenosis due to rheumatic heart disease, the patient will also have a mitral stenosis because the rheumatic heart disease most commonly involve mitral valve and later on it will affect the aortic valve. The last one is senile aortic stenosis, mean that the patient will have a aortic stenosis due to the age-related degeneration or the wear and tear of aortic valve. This type, the senile aortic stenosis, is the most common cause of aortic stenosis in old age people. Normally, the age group which cause the senile aortic stenosis are around 70 to 90 years of age. So it was all about the causes of aortic stenosis. Now let's discuss the physical sign in aortic stenosis. The first physical sign in a patient with aortic stenosis is harsh ejection systolic murmur, which is heard best at second intercostal space on the right side of a chest, and this murmur radiate to the neck or the carotid artery. This harsh ejection systolic murmur is also called as crescendo and the decrescendo murmur, mean that this murmur will first increase in intensity, called as crescendo, and then it will decrease in intensity called as decrescendo murmur. This crescendo and the decrescendo murmur is also sometimes termed as diamond shaped murmur, because the crescendo and the decrescendo will look like a diamond shape. So it is a very important and the diagnostic sign in aortic stenosis. But one thing which I like to highlight is that this murmur, the harsh ejection systolic murmur, also occur in pulmonary stenosis and hypertrophic cardiomyopathy. To differentiate it, the pulmonary stenosis murmur occur in second intercostal space on left side of the chest, and it do not radiate to the neck or the carotid artery. And the hypertrophic cardiomyopathy and the aortic stenosis murmur are differentiated on a basis of maneuvers. We perform different maneuver and we differentiate it. We will study this maneuver in hypertrophic cardiomyopathy section. Other than murmur, the patient of aortic stenosis will have a slow rising carotid pulse, also called as parvus etardus, mean that the carotid artery will upstroke slowly. Why this occur? As we discussed that in aortic stenosis there is a decreased systolic blood pressure due to the obstruction at aortic valve. So due to the decreased systolic blood pressure, there will be a decreased carotid upstroke called as parvus etardus. The next physical sign is soft S2. The soft S2 occur due to the calcification and the fibrosis of aortic valve, and the patient will also have S4 and the tapping apex be due to the left ventricular hypertrophy due to the obstruction to the forward flow of blood. So it was all about the physical sign in a patient with aortic stenosis. Remember that these physical signs are very important in exam and in both in clinic, because usually the patient of the aortic stenosis are asymptomatic. So these physical signs will lead to the further investigation of a patient. So it is very important, and if we diagnose it early, we will intervene early and a patient will have a better prognosis. Let's discuss the investigation to be performed in patient with aortic stenosis. The first one is the echocardiography. The echocardiography is the pivotal investigation in a patient who is suspected of having aortic stenosis. The echocardiography will demonstrate the restricted valve opening. Let's discuss the echocardiographic changes in aortic stenosis. You guys can see this image. This is an echocardiogram of normal individual during diastole. You guys can see that the aortic leaflets are closed and thin, and you can see the point of coaptation with this arrow is marking the point of coaptation. Now switch toward this second image. This second image is showing a calcified aortic stenosis in diastole. You guys can see that the aortic leaflet are thick and calcified. Now after diastole, now let's study these changes during a systole. You guys can see that in a normal individual the aortic leaflets are open. You guys can see the open aortic leaflets here. While in a calcified aortic stenosis there will be a thick aortic valve leaflet and they will barely move. You guys can see this thickened and immobile aortic valve leaflet in this image. After the echocardiography, which is a most important investigation in aortic stenosis, the second one is a Doppler echocardiography. The Doppler echocardiography is performed because it will assess and it will calculate the systolic gradient across the aortic valve. So it will give the rough estimate of the severity of the aortic stenosis. Other than this echocardiography and the Doppler echocardiography, we can also perform ECG. But remember that these ECG changes in aortic stenosis are usually found in advanced disease. On ECG, there will be a sign of hypertrophy and there will be a downsloping of ST segment and T inversion. These changes are usually seen in lateral leads reflecting the left ventricular fibrosis. Other than these, we can also perform CT and MRI, and these tests will help to assess the degree of valve calcification and stenosis. It was all about the investigation that we should perform in aortic stenosis. Now switch our gear toward the management of aortic stenosis. The management of the aortic stenosis depend on severity. If a patient presents with a mild symptom or patient is asymptomatic, or the valvular gradient across the aortic valve is less than 50 mm of Hg. For this kind of patient, we usually put a patient on observation, and the Doppler echocardiography is performed every 1 to 2 years to check the severity or the progression of a disease. Apart from this, no treatment is required, and if there is a mild symptom, we can give a conservative symptomatic therapy. Other than this, if a patient present with symptoms, such as if the patient present with even a single syncopal attack, we should perform an immediate valve replacement. Other than this, if a patient is asymptomatic but patient have a severe aortic stenosis and there is a deteriorating ECG, mean that the ECG is showing a sign of left ventricular hypertrophy and fibrosis, in this case the valve replacement is also recommended. Other than this, if a patient needed a surgery but the patient is unfit for surgery, in this case we can perform a percutaneous valvuloplasty. But remember that this aortic balloon valvuloplasty is useful in congenital aortic stenosis, but it is of less value in old age. Now a question arises that which prosthetic valves are preferred as a valve replacement therapy in aortic stenosis. Remember that there are two types of a prosthetic valve. The first one is a biological or the tissue valve, and the second one is a mechanical valve. The biological or the tissue valve is preferred in elderly or the old age people, and these valves do not require anticoagulation, while in younger age we prefer a mechanical valve, and with mechanical valve we will prescribe an anticoagulant. By now we have discussed that when we will need a valve replacement and what are the types of a prosthetic valve. But now let's study the indication for surgery, that what are the indication in which we will perform surgery. The first one is that in all symptomatic patient, mean if a patient present with a syncope, angina or the sign of a left ventricular failure, we will perform a surgery. The second indication for surgery is that when a systolic pressure gradient across the aortic valve is greater than 50 mm of Hg, or if there is a greater pressure in left ventricle than aorta. In this case, we will perform a surgery. The third one is that when the aortic valve area fall below 0.7 centimeter square, we can perform surgery. The fourth indication for surgery is that if a patient is asymptomatic but is undergoing surgery for coronary disease, other valve disease, left ventricular dysfunction, or the progressive decline in left ventricular ejection fraction and mark left ventricular hypertrophy. If a patient is undergoing surgery for these disease condition and at the simultaneous the patient have a aortic stenosis, so the patient should perform a surgery for aortic stenosis. The fifth indication for surgery is an abnormal blood pressure in response to exercise, and the sixth one is a ventricular tachycardia. So all of these are the indication for surgery in aortic stenosis. It was all about the aortic stenosis. If there is still any question, you guys can ask, and stay tuned for more update.